Keep quiet. This is forearm, arm, forearm, shoulder, arm, forearm, and the hand. That is the clavicle. That is the clavicle. Below that, the brachial axillary artery and axillary vein is coming down, and at the level of teres major, it becomes axillary in nomenclature. All right. Now you see, this is the pectoralis minor. Pectoralis minor is supplied by the medial pectoral nerve. This is medial pectoral nerve. This one is the medial pectoral nerve. This one. And this is the lateral pectoral nerve. And there is a nerve loop between the two. Medial pectoral nerve supplies both both the pectoralis major and the pectoralis minor. Now the brachial artery is coming down just below the elbow joint. This divides into radial artery and ulnar artery, right? This area is overlapped by the pronator teres. This is ulnar head of pronator teres. There is the tendinous arch of flexor digitorum superficialis. This one, all right. Now, the ulnar nerve, which lies in between the brachial artery, between the axillary artery and axillary vein, and slightly in a posterior plane. This pierces. This pierces the deep fascia in between the it runs down in between the medial epicondyle and the olecranon process. It runs down in between the olecranon process and medial epicondyle. Here it pierces the deep fascia near the middle of the arm along with the superior ulnar collateral artery. ঠিক আছে, এই যে ডিপ ফাসাকে পিয়ার্স করে, মিডিয়াল ইন্টারমাসকুলার সেপ্টামকে পিয়ার্স করে, the piercing of the medial intermuscular septum by the ulnar nerve is along with superior ulnar collateral artery, and it runs down behind the medial epicondyle. It runs down behind the medial epicondyle and appears in the forearm, lying superficial to the oblique and posterior band of elbow joint. ঠিক আছে, and in between the two heads of flexor carpi ulnaris. ঠিক আছে, oblique and posterior band of elbow jointed superficially in between the two heads of flexor carpi ulnaris. All right, this is radial nerve. This is the brachioradialis. This is brachioradialis muscle. The nerve is entering superficial. This is brachioradialis is at the back and posterolateral aspect. All right. And in the cubital fossa, just below the elbow, the radial nerve divides into superficial and deep branch. Right. Now the deep branch is the posterior interosseous nerve. The deep branch is the posterior interosseous nerve, and the superficial branch will come along the lateral aspect of the forearm. Right. Now you see the median nerve that is at first lateral to the brachial artery, then in front, then medial to the artery. This is the median nerve coming down just below the deep to the flexor retinaculum. Flexor retinaculum এর posterior layer এর সাথে anterior layer এর সাথে plastered থাকে হচ্ছে median nerve. Median nerve remains plastered with the anterior surface with the anterior layers of the flexor retinaculum. Right. I didn't draw the part within the hand because I have drawn it. ঠিক আছে, superficial and the deep branches of ulnar nerve, median nerve, I have drawn it earlier. Right. Now follow. Now one thing is regional understanding of the course of the nerve and their branches. One thing is regional, part by part, regional understanding of the nerves along with its branches. All right. The next part is the continuous study of the individual nerves. All right. How to describe the median nerve in continuity, how to describe the ulnar nerve in continuity, how to describe the radial nerve in continuity. বোঝা গেল? প্রথমে হচ্ছে একটা আমি রিজিয়নে at first I have seen the location of the nerve with the branches that is coming out, all right, regionally. Then I am going to describe it in continuity. Then I am going to describe it in continuity. That is median nerve coming from the two roots, that is from lateral root and medial root, joining it in front of the axillary artery and vein, and this combined root forming the median nerve is coursing downwards, first lateral to the brachial artery, then in front in the lower third it is medial to the brachial artery, then it is running down in between two layers of pronator teres, in between the two heads of pronator teres, and close to the wrist it is in between the flexor carpi radialis and palmaris longus, right, and entering deep to the flexor retinaculum and dividing into medial and the lateral division, medial and lateral division, not branches. So medial division is giving two proper digital nerves to the thumb, then another proper digital nerve to the lateral aspect of the index, then common digital nerve to this index, middle and ring finger, and the rest of the part is supplied by the superficial cutaneous branch of the ulnar nerve. All right, this supply on the dorsum of the finger, this palmar branches supply the terminal phalanx of the thumb, and both the terminal and middle phalanx of the other digits. All right. Now this median nerve supplies the thenar eminence, and the ulnar nerve supplies the hypothenar eminence, together with all the intrinsic muscles of the hand, except first and second lumbricals, which is supplied by the median nerve, and third and fourth lumbrical, which supplies the flexor carpi ulnaris. This starts from the median nerve just below the pronator teres. Just below the pronator teres, one branch of median nerve starts, which is known as anterior interosseous nerve. All right, supplies the flexor carpi ulnaris and goes downwards deep to the pronator quadratus. ठीक है चे? एखाने close to the wrist there is a muscle called pronator quadratus, and the anterior interosseous branch lying on the interosseous membrane. It goes deep to the pronator quadratus. ठीक है चे? So the description of median nerve is almost completed. All right. You will also mention the cutaneous branches, the vascular branches and articular branches. ठीक আছে? তোমরা যখন when you will write this description, you will mention the cutaneous branches, articular and vascular branches. One thing to be mentioned, that vascular branches of the superior extremity comes from the lateral horn of T2 to T7 segment. এটা মনে রাখবে, ঠিক আছে, লিখে দেবে। The preganglionic fibers for the vascular branches of the superior extremity comes between T2 to T7 lateral horn of the spinal cord, right? And postganglionic fibers starts from inferior cervical ganglion and the superior thoracic ganglion. ঠিক আছে, postganglion fibers কোত্থেকে আসে? inferior cervical ganglion আর superior uppermost thoracic ganglion থেকে postganglionic fibers গুলো আসে, মনে থাকবে? All right. Now median nerve, description of median nerve is almost done, right? Now you see the ulnar nerve. Ulnar nerve is coming in between the brachial artery and the vein, axillary artery and axillary vein. The nerve is more in the posterior plane. In the anterior plane there is medial cutaneous nerve of forearm. ঠিক আছে, medial cutaneous nerve of forearm টা অ্যান্টিরিয়র প্লেনে রয়েছে। আমি বললাম না, লিফট আপ করলে, ইফ ইউ লিফট আপ দ্য ব্লাড ভেসেলস, ইউ উইল সি ulnar nerve is in a deeper plane, and if you lift up more, you will see the radial nerve is more in the deeper plane, coming from medial to lateral. ঠিক আছে, এই জায়গাটা coming from medial to lateral. This is the radial nerve, all right, and this is the ulnar nerve. Ulnar nerve pierces the deep fascia. Ulnar nerve pierces the deep fascia, nearly half of the arm, along with the superior ulnar collateral artery lying between medial head of triceps and the shaft, and it comes down between the medial epicondyle and the olecranon process. The groove where the ulnar nerve lies behind the lower end of humerus, there is a part of diaphysis that descends down. আমি পরে বুঝিয়ে দেবো তোমাদের, ঠিক আছে। ডায়াফাইসিসের লোয়ার এন্ডটা আমি তোমাদের পড়িয়েছিলাম, মিডিয়াল এপিকন্ডাইল, মিডিয়াল পার্ট অফ ট্রক্লিয়া, ল্যাটারাল পার্ট অফ ট্রক্লিয়া উইথ ক্যাপিটুলাম অ্যান্ড দ্য ল্যাটারাল এপিকন্ডাইল পড়িয়েছিলাম না এই পার্টটা। মিডিয়াল এপিকন্ডাইল আর ডায়াফাইসিসের মাঝখানে একটা পার্ট এরকম করে নিচের দিকে ডিসেন্ড ডাউন করে। Ulnar nerve doesn't lie just behind the medial epicondyle. It actually lies behind that descending part of the diaphysis, in between the medial epicondyle and the shaft, right? Then it comes and enters the front of the forearm in between two layers of flexor carpi ulnaris, lying superficial to the posterior and oblique band of elbow joint. All right, it descends down with the fast lying in between the flexor digitorum superficialis and flexor carpi ulnaris. All right, resting on the flexor digitorum profundus, resting on the flexor digitorum profundus. And the ulnar artery is on its radial side. All right, on the upper part, this nerve is more superficial, but in the lower part, ulnar nerve is more in the deeper aspect, lying on the flexor digitorum profundus. ঠিক আছে, just close to the hand, it gives a palmar cutaneous branch over the flexor retinoculum, and along with the ulnar artery, it goes on the medial aspect and divides into superficial terminal branch and deep terminal branch. Deep terminal branch passes just below the hook of the hamate, all right, and occupies the deep palmar arch of the artery, deep palmar arch of the palm. ঠিক আছে, after supplying the palmaris brevis, the ulnar nerve divides into superficial terminal branch and the deep terminal branch. ঠিক আছে, superficial terminal branches cutaneous supply I have told you, all right, and from the deep branch all the intrinsic muscles of hand except the first and second lumbricals is supplied by the ulnar nerve, right, except the first and second lumbricals which is supplied by the medial nerve. ঠিক আছে, now let me give you some, I will talk about radial nerve in the next opportunity. Now the clinical importance of median nerve. What is the clinical importance of median nerve? Number one is carpal tunnel syndrome. All of you know that is weakness and loss of sensation of the thenar eminence and associated with the medial 2.5 fingers. Lateral 2.5 fingers. Now, how to test this? Due to compression in the carpal tunnel mostly due to osteoarthritis and anterior dislocation of lunate bone. ঠিক আছে, lunate bone এর anterior dislocation এ compression হয়। ঠিক আছে, now how to diagnose it clinically? Clinically কি করে diagnose করে? Now there is a test called Phalen's test, Phalen apostrophe S, Phalen's test. All right, the patient is asked to put his dorsum up opposed, দুটো ডরসাম অফ দ্য হ্যান্ডকে অপোজ করে রাখতে বলা হয়। ঠিক আছে, এটা করলেই কি হবে, কার্পাল টানেলে কম্প্রেশন হবে। ঠিক আছে, হলেই দেয়ার উইল বি tingling and numbness over the area of cutaneous supply of the median nerve. ঠিক আছে, that is the thumb, index and digital and the middle finger. এটার ওপরে যে cutaneous supply আছে, there will be sensation of tingling and numbness. This is called carpal tunnel syndrome. Now, how to operate on carpal tunnel syndrome? কি করে অপারেট করবে carpal tunnel syndrome? How to release the nerve? How to release the nerve? Through a vertical incision or a transverse incision over the, কি করবে, vertical incision দেবে wrist-এ না horizontal দেবে। ওই দেখো, হোয়াটস ইউর নেম জেন্টলম্যান, তোমার নাম কি? হ্যাঁ হ্যাঁ, আদিত্য। সো ওয়ার দেয়ার ইজ সো মাচ ব্লাড ভেসেলস, nerve in the vertical disposition, how can you incise in transversely? You cannot incise transversely. এখানে এতগুলো নার্ভ যাচ্ছে, আর্টারি যাচ্ছে, ভেইন যাচ্ছে, ठीक है, तो उसको तुम ट्रांसवर्सली इंसाइज करोगे तो कट जाएगा। ठीक है, sit down. So there will be splitting, vertical incision, avoiding the median nerve plane, open it, then release the nerve from the posterior aspect of the flexor retinaculum along with osteophytes, the attachment with the fibrous attachment to the osteophytes, then close it. Not much handling of the nerve within the carpal tunnel. Carpal tunnel নিয়ে নার্ভটাকে খুব বেশি হ্যান্ডেল করা হয় না। ঠিক আছে, now there is another term, how to test. What are the other features of median nerve injury? What are the other features of median nerve injury? আর কি কি ফিচার হয় মিডিয়ান নার্ভ ইনজুরিতে? If you do a pain test, if you do put the hand of the patient on a plain surface, ask him or her to touch a pen, just put like this. He needs to abduct the fingers and extend the fingers to touch this tip of the pen, right? Abduction as well as extension, both is needed, right? Remember, mone rakhbe, this is flexion of thumb, this is extension of thumb parallel to the plane of the palm, palmer je plane tar parallelly move korche eta, ঠিক আছে? Adduction and abduction is perpendicular to this plane. Adduction and abduction is perpendicular to the plane. ঠিক আছে, এই মুভমেন্টটা কি হলো, এই প্লেনটার পারপেন্ডিকুলারলি মুভ করবে। ঠিক আছে, so the attitude of the hand will be, there will be loss of abduction, flexion and opposition. ঠিক আছে, এই তিনটে মুভমেন্ট থাকবে না, together with which is pronounced by the unopposed action of extensor pollicis longus. ঠিক আছে, extensor pollicis longus এটাকে আরো বেশি এক্সটেনশন পজিশনে রাখবে। ঠিক আছে, not the adduction and opposition, right? In case of apes, দেখেছো, monkey দেখেছো? Have you seen monkey? If you give him a stick, একটা লাঠি দিলে, ঠিক আছে, we hold a stick in this fashion, because our opponent's action, flexion, adduction and opponent's action of the thumb is well developed. But an ape, a monkey, holds it in this direction. There is absence of opponent's movement, right? This is called ape thumb. This is called ape thumb. Now there is another thing. If you ask the patient, clasp his hand to clasp his two hands. If you ask the patient to clasp the hand where the ulnar nerve is injured, there will be failure of flexion of the index finger. Failure of the flexion of the index finger, which is supplied by, that is the lateral half of flexor digitorum profundus, which is supplied by what? Median nerve. Alright. So there will be inability to flex the index finger, and it will come out as an extended index finger. This is called Ulnar clasping test. Ulnar clasping test, right? Now there is example of Froment sign, which I have not agreed. I have read it earlier also. I do not agree that holding a card in between the index and inability to hold a piece of paper or a card in between the thumb and index finger. I didn't understand, because there is no problem of adductor polysis, there is no problem of adductor polysis, and there is no problem of palmar or dorsal interossei. So why the patient will be unable to hold a piece of paper or a cardboard in between the thumb and the index finger? I am not agreed with this. These recent books are writing that Froment sign is a test for median nerve. I will advise you not to write Froment sign as a test for median nerve. Froment sign likhbe na. ठीक है? This much is enough. All right. The attitude of the hand will be one of adducted, not abducted, and extended, where the flexion, opposition and abduction is at fault. ঠিক আছে? এটা মনে রাখলেই হবে যে অ্যাডাক্টার পলিসিস বেঁচে আছে, ইটস লিভিং। So attitude of the hand will be this one, right? So median nerve is, description of median nerve is altogether done. Now let us talk about what is the time now. How many minutes are left? 2 minutes. Oh, okay. Now you see, the course of ulnar nerve that I have told you. All right. Now, one thing is cubital tunnel syndrome for ulnar nerve. Cubital tunnel syndrome for ulnar nerve. When it is injured above pronated teres, at a level above the pronated teres, supplying the muscular branches to flexor carpi ulnar. Flexor carpi ulnar is also supplied near the elbow, just above the elbow by the ulnar nerve. Remember this thing. All right. Flexor carpi ulnaris, pronated teres, all these are supplied close to the elbow joint, right? And if there is any injury at this level, there will be sparing of flexor digitorum profundus. Medial part of flexor digitorum profundus, medial part of flexor digitorum profundus is supplied by ulnar nerve. All right. If the injury is high above, the flexor digitorum profundus is spared. If it is in the low down, there will not be sparing of flexor digitorum profundus. So in the ulnar nerve injury, what we see? We see the extension at the metacarpophalangeal joint and flexion of the interphalangeal joints. All right. If it is close to the, if it is close to the close to the hand, if it is close to the hand, there is more active, there is less active movement of this medial to fingers. But if it is injured above, where there is long tendons are spared, all right, there is usually active flexion of this interphalangeal and the distal phalangeal joint. ঠিক আছে, বোঝা গেল? তো দিস ইজ কল্ড আলনার প্যারাডক্স। ঠিক আছে, বাকি তোমরা পড়ে নেবে। অল রাইট, টেস্ট ফর আলনার নার্ভ, টেস্ট ফর আলনার নার্ভ। ঠিক আছে, ওখানে যে এই দুটো ইন্ডেক্স অ্যান্ড মিডল ফিঙ্গার, ইফ ইউ গিভ এ কার্ডবোর্ড অর piece of paper and ask the patient to hold it tightly in between the index and thumb, this will be done, this could be done, because the palmar and dorsal interossei, that is adductors are palmar interossei, adductors are palmar interossei, so these two fingers can be adducted, so it can be tightly hold in between the index and মিডল ফিঙ্গার। ঠিক আছে, চলো আর কিছু যদি বলতে হয় পরে বলে দেবো। ওকে, আমাকে একটু ধরো। ওকে, থ্যাংক ইউ। আমাকে একটু ধরো। থ্যাংক ইউ অল অফ ইউ।